With its health system on the brink of collapse, India's daily rise in coronavirus cases has remained above the 300,000 mark for a sixth straight day. And doctors fear a further peak in infections is still to come, despite medical aid starting to arrive from across the world. We have seen the first shipment of medical supplies from Britain arriving here in Delhi, with the Indian Foreign Ministry calling it international cooperation at work. A train as well carrying 70 tonnes of oxygen from the eastern state of Chhattisgarh arrived in Delhi too. And the situation, though, continues to remain serious. Over the past 24 hours, let's show you the figures. India recording over 320,000 new cases of the virus. And more than 2,700 fatalities have been reported. So that brings the total number of deaths to over 195,000. Our correspondent Nikhil Anamda told us more about the international aid that's begun arriving.
It is indeed a drop in the ocean given the scale of the crisis that we're facing at this point in time. But we have now seen at least 200 pieces of vital medical supplies being coming from the UK into the capital Delhi, including about 100 ventilators as well as 95 oxygen concentrators. Later in the week, more oxygen concentrators as well as invasive and non-invasive ventilators are scheduled to arrive. And the UK government has said that it is continuing to have consultations with the Indian government in terms of what else it can do in terms of providing assistance going ahead. Of course, given the scale of the crisis, like I said, this is a drop in the ocean, but India's also been seeing medical supplies and aid coming in from various other parts of the world. We've also seen, for instance, ventilators land from Frankfurt and Paris and oxygen concentrators from the United States. And yesterday, Prime Minister Modi had a call with President Biden in which they discussed crucial ways in which the US can help India in this current state of crisis. The US has taken an important decision to essentially release about 60 million doses of the AstraZeneca vaccine to other countries as and when they become available. Of course, it remains to be seen at this point in time how much of those would come to India and really when they would come to India.
Let's bring you a sense now of just how difficult and challenging and emotionally draining it is on the front line. I'm joined by Dr. Devastates. He is in his final year of training to be a psychiatrist. He has been working, though, right on the front line, treating coronavirus patients in a hospital in Gujarat. Doctor, I know you must be tired. Thank you for taking the time to talk to us. You've only recently come off shift. What was it like today?
It was just like any other shift. New patients are coming in as usual. And as you rightly said, the number of cases are definitely on the increase. We are just managing by the skin of our teeth right now. The situation is very grim.
What do you need most?
I think more than the resources, which are, as you rightly mentioned about oxygen, the beds and all, that are being arranged. But the main thing that we are lacking is the manpower. So we do not have the trained doctors and the trained nurses and the support staff that is needed to run large-scale hospitals for such a long duration of time. So as a psychiatry resident, now I am being pushed into COVID, and all other doctors are also working in COVID full-time, because of which the other medical services are being neglected. And that is an area of concern that comes to my mind straight away.
When I spoke to a doctor in Delhi yesterday, he said to me, the healthcare system is broken, but we, the healthcare workers, are about to be broken as well. Given things are expected to get worse, is that what you fear?
Yeah, because, past 1 month, most of us have been having continuous duties in the COVID wards. And, previously in the first wave, we used to have at least a period of 1 week's gap between the two postings. But currently, because of the shortage of the medical staff, we have not had that privilege so far. So a lot of sleepless nights on the horizon coming in as well.
Tell us about the patients that you're treating, because it seems anecdotally there are younger patients being admitted to hospitals around the country. Is that happening where you are?
Yes, that is a trend that is, I think, seen all over India. We are seeing patients as young as 30 years of age being put on ventilators. And these are patients who do not even have any other comorbidities like diabetes or hypertension. Even our pediatric wards are running full. So even young children, less than 18 years of age, are getting affected.
So doctor, does that mean that you're seeing, if you're seeing younger patients, does that mean you're actually seeing entire families?
Yes, that is what is happening. As Indian houses, they do not have separate rooms, most of them. to follow the isolation protocol. So what happens is that if one member gets affected, all the family members are getting infected too. And the rate of infectivity is also higher in this strain of the virus that we're seeing. So entire families, even the entire apartments are getting affected at one go.
And what is happening in Gujarat? It's a state we haven't talked about a lot. What's happening with infections?
When you talk about the numbers per se, yeah, we do not have as many numbers as in Delhi or in Maharashtra. But if this trend continues for a period of more than 1 week, then we will also be facing severe shortage like we are seeing in Delhi and Mumbai and other places right now. Right now, currently, we have the resources, we have the beds and the oxygen supplies, and even more and more oxygen plants are being getting set up. Also, the industrial oxygen is getting diverted, and the international help is coming in. So we are just hoping that we can survive somehow this week, and after that week, we are expecting that the help will arrive.
There must be many people who are worried, scared, and desperate.
Yeah.
What would be your message to them?
Yeah, there is a widespread atmosphere of panic everywhere, and something has got to do with it. Also, how the media is covering the entire COVID-19 pandemic in India. If you see the visuals, they are very scary. So someone who is having a dinner at his place is able to see all the places of crematorium, and that's not a good sight to see. So that is creating more unrest and more panic. So rather than that, we need to spread positive stories as well. There are patients getting discharged from hospitals and going back to their homes. So that needs to be conveyed as well. Also, the vaccine hesitancy. That is a major factor which is hampering in our fight against COVID-19 pandemic. So if we create more and more awareness about the vaccination program, and now that we are opening up vaccination for all age groups starting 1st May 2021, we are hoping that people get vaccinated. And because we all know vaccines, masks, and social distancing, these are the only 3 tools that we have.
Dr. Polka, very positive message for you to end on in what is a difficult time. We do thank you for taking the time, and we'll be thinking of you all in the coming days. Thank you. Our website has a full visual guide. Dr. Polka was just referring to how staggering it can be to look at those graphs and some of the statistics. We have the charts for you on the website, the number of cases, hospital beds, supplies of oxygen, which is so crucial as well, and comparisons to other countries and first-hand reporting from our amazing team of correspondents based in India. It's all there for you, bbc.com/news. Do log on and take a look.